Acupuncture, it's a system of medicine. It comes from China, and it's actually the oldest continuously practiced form of medicine on the planet. The Chinese had these thoughts over thousands of years that there was this energy circulating in the body. They called it qi. They believed that when the qi got stuck at specific points, then by sticking a needle into a specific point, that same specific point, it encourages the circulation. So they kind of believed everything was based on circulation. From a Western medical conventional standpoint, we've decided, and we're starting to learn a lot about acupuncture and how it works. We've learned that when we put needles into specific points in the body, it actually causes different parts of the brain to activate. This causes chemicals to be released, things like neurotransmitters, endorphins, enkephalins, dopamine, regulates serotonin, does all sorts of interesting things, which we found to be very beneficial to the body.
We have acupuncture here every week on Friday, and sometimes the clients see me before and then they go into an acupuncture session later, and sometimes they go into acupuncture first and see me afterward. I see a big difference in the clients if they've seen me before or after acupuncture. They are more relaxed, more focused, more calm, more centered after acupuncture. And that to me means that they're also more open to the process of therapy.
One of the strengths of acupuncture, which falls under the umbrella of Chinese medicine, is that it's not a one-size-fits-all. It's custom medicine. We treat the individual, we don't treat the disease, we don't treat the addiction, the disorder specifically. We treat the individual and what that addiction has caused to happen in their body, and that's how we help to restore health.
People have their choice of whether or not they want to go into acupuncture. The vast majority of our clients do. They find it very helpful. They come back week after week after week.
With the ear protocol that we do for addiction, it's 5 needles that go in the ear. With the body protocol that I created, it's actually about 4 needles, typically below the elbows and below the knees on the body.
It helps fight the early parts of recovery that people really struggle with, like managing urges and cravings. It helps them with becoming less confused, because confusion's a big part of early recovery, increasing their stress resiliency, their stress tolerance. In other words, it also can help them with their sleep patterns. Getting back to sleep. Sleep is a big issue in early recovery.
Studies have shown acupuncture has a balancing effect on the autonomic nervous system. This reduces substance craving. Its real strength is that it's a non-verbal, non-threatening treatment that has an immediate calming effect, regardless of the substance used, and whether or not a coexisting psychiatric disorder has been diagnosed. It's also very effective at improving program retention and reducing the need for pharmaceuticals. We offer the unique feature of acupuncture that is customized to the patient. I'm very excited about this because this allows us to address physical and psychological conditions that have been kind of going on concurrently with the dependency, such as, for example, chronic pain, grief, depression, and trauma. And this can especially be helpful in the treatment of dual diagnosis patients, since acupuncture is also effective in the treatment of depression, chronic anxiety, post-traumatic stress, and many other disorders.
We offer acupuncture every Friday. It's voluntary to clients, and it is one of the most popular things that we have here on a consistent basis.